Hi, my name's Gavin and I'm a trainee consultant biomedical scientist within pathology. So my day-to-day role involves working with patient samples that are sent to us from all areas of the hospital, preparing them for analysis to look down the microscope, essentially to look at whether a patient has cancer or not, and giving a report back to the clinicians on the wards just so they can then manage the patient moving forward. That can be varied across pathology. You can either work in blood sciences where you'll be looking at blood samples, putting them onto analyzers and working out what's happening in the patient's blood profile to work out what's happening. Microbiology, looking at potential infections, patients having, what treatments they may need, or in cellular pathology, looking at whether a sample has cancer or not. So the best thing about my role is that every day is different. You can come in, you get things from all the clinical teams from across the organisation, so it gives you that variety. Not only that, but you can actually work out what's happening to a patient just from looking at tiny pieces of their tissue without ever having seen them. A career in pathology typically requires you to have A levels in sciences, specifically chemistry and biology. Not only that, and then to also think how that would then link into your university choices if you wanted to go down the biomedical science route. So checking the Institute for Biomedical Science website to see which universities are accredited, to give you the state registration to practice as a biomedical scientist. Not only that, but to be thinking about, if you don't want to go to university, there are other direct options available to you. You can come and work as medical laboratory assistants or associate practitioners. So my career journey began in 2004 when I started my BSc in biology. On completion of that, I saw a job to go and work in pathology. So I applied and was successful and entered as a medical laboratory assistant. So that role involved me supporting the biomedical scientists on a day-to-day basis within histology. And it really opened up my eyes to the career options available. So from there, I underwent an equivalence journey where I had my degree assessed by the Institute for Biomedical Science, and they asked me to do some additional top-up modules with another university to get me to that accredited status and to allow me to complete my registration portfolio to join the HCPC and become a state-registered biomedical scientist. In terms of what I would advise for people wanting to go down this route, obviously I came down the route of equivalence. There is the direct access route where you can go straight to an accredited university and become a biomedical scientist and undergo a placement year in an NHS hospital to get your registration portfolio completed. There is also, if you're like me, you want to come in at the entry level and become a medical laboratory assistant, there is then apprenticeships that you can do. Not only that, but I would also advise, if you're interested in a career in pathology, just to contact our work experience team, who will then approach us to organise a week-long placement so you can come in and see what happens in pathology and if this is a career for you.